An average of 8 people die in more than 27 road accidents recorded daily in Uganda. Some die on spot, others on their way to or in hospital, while others succumb later to sepsis caused by serious injuries from the crashes. Apart from accidents, cardiovascular illnesses, fires, choking, drowning are some of the leading causes of death globally. Death that can sometimes be prevented with adequate pre-hospital care. Dr. Paul Omago, with a team of fellow health experts, have now ventured into providing pre-hospital services, something they say is lacking in Uganda.
Pre-hospital care basically is taking the hospital intervention to the field. And the field in this case is in reference to anywhere, whether in the house of somebody who has called for care, whether en route for people who are involved in road traffic accidents.
He says people are not informed about pre-hospital care and services.
When people don't know that a service can be brought to them, it is a very big challenge. Because the first responder, for example, not being able to call for help out of the hospital setting is the most big challenge. There is a challenge of the community itself in terms of respecting how much you are responding to a call. For example, you're moving in an ambulance to respond to an emergency, let's say in Bwaise. But for you to access the route, there are no access roads for the ambulance, and even the small route which is available may not be open enough for you.
The team has acquired ambulances and have set up a call and dispatch center.
Listen carefully and I'll tell you how to do chest compressions.
Our goal is to really uphold the concept of the Good Samaritan concept, which basically means that if you get an accident out there, if you're knocked when you're on a border, or you're walking, you're in labor in the street, a Good Samaritan who calls in here can get instructions to help give chest compressions, as you can see here.
We have a total of 7 ambulances with doctor's car, inclusive, and motorbikes. These are all advanced life support ambulances.
However, they say the delay in the policy on emergency care is crippling pre-hospital care services.
So when you bring an ambulance like a doctor's car, it's clearly built as an ambulance with equipment inbuilt in it. It is difficult for example, the clearing agents to actually get this vehicle out of URA, because that vehicle is not called an ambulance according to our laws.
The ministry, however, emphasizes training of first responders.
I cannot deny that the police just get the people and put it on a pickup. But I want to say that probably there is also a knowledge gap. That is what we are saying, that let's have everybody trained professionally.
In order to reduce premature deaths, other experts in the emergency Medicare field say the focus should be put on pre-hospital trauma care systems, particularly those that require minimal training and relatively little in the way of equipment or supplies.
Our employers should also put this in their occupational health plans. So people should make sure their employees are actually trained in first aid and provision of life-saving treatment to themselves and their colleagues.
A simple thing as stopping bleeding is very key to be managed right at the site.
Let the first aid provision start with the vehicles, public transportation vehicles. They should be having first aid facilities.
Unfortunately, the capacity to provide this basic level of medical care does not exist in many parts of the country. Walter Mwesije, NTV.